Good afternoon, sir. This is Vinalcresia T. Fino, and for today's video, I'll be showing the lower limb foot for the AP or AP axial projections and AP oblique projection, which includes the medial and lateral rotation. And lastly, we have the lateral projection, which includes the medial and lateral rotation. So let's start to the AP or the AP axial projection. So the IR size for this is the 24 by 30 centimeter lengthwise. So for the patient position, supine is the best recommendation for this projection, and flex the affected knee of the patient. Next is for the position of the part. Place the patient foot's, the IR is placed under the patient's foot and center to the third metatarsal. So this is the third base metatarsal. Next is the entire plantar. This one, the entire plantar should be rest in the IR, and i-make sure lang na hindi po mag-slide yung IR, and it's better po to put a stopper over here para hindi po mag-slide yung IR towards this direction. And of course, ensure na wala pong rotation yung foot. And lastly, i-ensure din po natin yung gonad shielding for the radiation protection of the patient. So for the central ray, on 10 degrees forward to the heel, to the base of the third metatarsal, perpendicular to the IR, and toward the base of the third metatarsal. So in this projection, it helps to determine the location of the fragments in fractures of the metatarsal. And for the additional information, it should be the angle of the central ray is in 10 degrees perpendicular to the metatarsal to reduce the foreshortening of the part. And of course, let's not forget to put the annotation. So this is my, I expose the left side of my foot. So now let's proceed to the AP oblique projections for the medial rotation. So the IR size is 24 by 30 lengthwise. And for the patient position, supine position, and flexed again the affected knee to have a plantar surface of the foot rest firmly. So for the position of the patient, place the IR under the patient's foot. Rotate the leg medially until the plantar surface reach the 30 degrees on the IR. Rotate medially, this one. Then next is center it to the midline of the foot at the level of base third metatarsal. So this is the third metatarsal. Let's just rotate it 30 degrees medially. Of course, let's ensure the gonad shielding for the radiation protection of the patient. So for the central ray, it should be perpendicular to the third metatarsal base. And the structural shown here is interspaces of the cuboid and calcaneus. So in this projection, the third and fifth metatarsal should be free from any superimposition. And again, let's not forget to put annotation here para malaman po kung anong side ng knee or ng foot ang gi-expose po. It's either left po ba or right. So now, let's proceed to the AP oblique projection, which is the lateral rotation. So the IR size is 24 by 30 centimeter lengthwise. The position of the patient, again supine position, and just flex the affected side of the foot. So for the position of the patient, place the IR under the patient's foot, rotate the leg laterally till the plantar surface forms 30 degrees to IR. So let's rotate our leg laterally and center the midline of foot at the third base metatarsal. So this is 1, 2, so this is the third metatarsal, the third base metatarsal. And of course, let's not forget to put the Gonad shielding for the radiation protection of the patient. So for the central ray, it should be perpendicular again to the base of third metatarsal. And the structure shown here is the first and second metatarsal is hindi po nag-overlap. And again, annotation pa din. So this is how it looks, the lateral rotation for the AP oblique projection. And let's have the last projection. We have the lateral projection. So let's go first for the lateromedia. So lateromedia, so the x-rays enter laterally and exits medially. So the image receptor used is 8 by 10 inches. And for the position of the patient, have a supine position and let the patient turn away from the affected side until the extended leg is placed laterally. So for the position of the patient, center the IR to the ankle joint. So this is my ankle joint. Let's just center the IR over there. And next, adjust the foot in a lateral position. So you can see it's a lateral position. So have the patient turn anteriorly or posteriorly as required to place the patella perpendicular to the horizontal plane. So my patella is perpendicular to the horizontal plane. If necessary, place a support under the patient's knee. And let's not forget to put the Gonad shield for the radiation protection of the patient. So the central ray for this is that perpendicular through the ankle joint. Perpendicular to the ankle joint and entering 1/2 inches superior to the lateral malleolus. Superior. This is my lateral malleolus. So 1.5 inches superior to the lateral malleolus. The structure shown here is that the resulting image shows a lateral projection of the lower third of the tibia and fibula, the ankle joint, and the tarsal. Last one is we have the mediolateral. So the IR size used is 8 by 10 inches. Position of the patient, the same with the lateral medial projection. And for the position of the part, place the long axis of the IR parallel with the long axis of the patient's leg and center it to the ankle joint. Ensure that the lateral surface of the foot is in contact with the IR. So this is the lateral over here, and it is contact to our IR. Dorsiflex the foot and adjust it in the lateral position. Dorsiflexion is required to prevent the lateral rotation rather, of the ankle. Gonad shielding is, we have to make sure the gonad shielding of the patient for the radiation protection. For the central ray, it should be perpendicular to the ankle joint, entering the medial malleolus. And the structural shown here, the resulting image shows a true lateral projection of the lower third of the tibia and fibula, the ankle joint, and the tarsals. Let's not forget to put the annotation. So I exposed the right side of my foot. This one.